Hi, and welcome to Crack the Boards. If you're new to this channel is dedicated to helping you excel in the USMLE. So be sure to subscribe, like, and share to support the channel and stay updated on the latest content. In today's video, we will focus on USMLE questions related to physiology. Let's have a look at the first question. A 29-year-old acrobat visits her physician due to stool incontinence following a fall from a height during a circus performance. Examination reveals normal resting tone in the internal anal sphincter, but rectal distension fails to elicit a change in the tone of the external anal sphincter or an urge to defecate. Which nerve is most likely compromised in this patient? A. Is it the myenteric plexus? B. Obturator nerve? C. Somatic efferent neurons? D. Thoracic sympathetic chain? E. Vagus nerve. The correct answer is C. Somatic efferent neurons. Control of the external anal sphincter and the pathway allowing conscious awareness of the urge to defecate requires the somatic nervous system and spinal pathways. Injuries to the sacral nerves during a fall can therefore result in a loss of stool continence. Let's have a look at why the other options are incorrect. Option A is incorrect as the enteric neurons of the myenteric plexus control the internal anal sphincter. Because relaxation of the internal anal sphincter is normal in this patient, the myenteric plexus is functional in this case. Option B is incorrect as the obturator nerve originates from the L2, L3, and L4 nerve roots. It provides sensation to the medial aspect of the thigh and controls the movement of the obturator externus, the hip adductors, and gracilis muscles. It is not involved in control of rectal tone. Option D is incorrect as the thoracic ganglia give off the greater, lesser, and least splanchnic nerves to supply the abdominal viscera. Inhibitory splanchnic sympathetic nerves are important in control of vascular tone and reduce secretion and motility. They are not involved in control of defecation. And option E is incorrect as the esophageal branch of the vagus nerve stimulates peristalsis and gastrointestinal secretions in the esophagus, stomach, gallbladder, pancreas, and small intestine. It does not affect rectal tone. Let's have a look at the second question. A 29-year-old woman consults a neurologist due to intermittent muscle weakness and difficulty swallowing over the past 6 months. 6 years ago, she developed a tremor that worsens with purposeful movements. During examination, her left eye fails to adduct when gazing right, while her right eye exhibits nystagmus. Leftward gaze is normal. Her diagnosis is confirmed through lab tests and imaging. Which primary cell type is directly impacted by her condition? A. Astrocytes, B. Microglia, C. Neurons, D. Oligodendrocytes, E. Schwann cells. The correct answer is D. Oligodendrocytes. Internuclear ophthalmoplegia, which is medial rectus palsy on lateral gaze, is often found in patients with multiple sclerosis. Multiple sclerosis is a chronic disorder of the central nervous system demyelination separated by time and space. Oligodendrocytes are the myelinating cells in the CNS destroyed in multiple sclerosis. Let's have a look at why the other options are incorrect. Option A is incorrect, as the finding of internuclear ophthalmoplegia in the context of prior neurological deficits that localizes elsewhere in the CNS is highly suspicious for MS. MS does not directly affect astrocytes, which provide physical support in the CNS and form the blood-brain barrier. Option B is incorrect, as microglia are CNS phagocytes and are not affected by MS. Option C is incorrect, as MS is a demyelinating disease of the central nervous system. The deficits seen are not caused by direct neuronal injury. Option E is incorrect, as Schwann cells myelinate axons of the peripheral nerves, and MS causes central nervous system demyelination. Schwann cells are affected in Guillain-Barré syndrome. Let's have a look at the third question. At the scene of a ski accident, a young woman is trapped in the snow, severely injured and unconscious. She is hyperventilating with both pupils dilated and unresponsive to light. When cold water is applied to either ear for vestibulo-ocular testing, both eyes move outward but do not move inward. Where is the lesion most likely located in this patient? A. Cerebral hemispheres, B. Lower pons, C. Medulla oblongata, D. Midbrain, E. Upper pons. The correct answer is D. Midbrain. Hyperventilation, bilateral inability to adduct the eyes, and bilateral mydriasis localize the lesion to the midbrain, which contains the nucleus of the third cranial nerve. Let's have a look at why the other options are incorrect. Option A is incorrect, as a bilateral hemispheric lesion would cause Cheyne-Stokes respiration, characterized by cycles of faster and slower breathing, interspersed with periods of apnea. Option B is incorrect, as a lesion in the lower pons would cause ataxic breathing, characterized by irregular periods of faster and slower breathing. It is not cyclic as in Cheyne-Stokes respiration. A lesion in the lower pons would most likely also affect the sixth cranial nerve, causing abduction impairment. In this patient, abduction of both eyes is intact. Option C is incorrect as respiratory arrest is due to a lesion in the medulla. This is because there are central chemoreceptors within the medulla that detect hydrogen ion concentration and stimulate or inhibit breathing. And option E is incorrect as apneosis or periodic prolongation of the inspiratory hold usually occurs with a lesion in the upper pons. This concludes today's set of questions. Thank you for watching. If you enjoyed it, please don't forget to subscribe to the channel to stay updated on our latest content and support our journey.